All right, thank you, Braden. We are talking about sudden cardiac arrest among athletes, and joining us this morning to talk more about that is Dr. Jody Ortega. He is a non-surgical physician, an orthopedic physician with the Andrew Sports Medicine Institute. Good to see you this morning, sir.
Thank you.
All right, so we've seen this happen. We've seen the horror stories about an athlete. He's maybe in a summer workout or at practice. He dies, and then after he dies, we find out, well, he had a pre-existing heart condition, didn't even know it. Is this something that maybe we can detect, though, in a routine exam, or is it something more complicated?
Sometimes you can find it in a routine exam, and that's why we do pre-participation exams or screening sports physicals, is try and find these kids that have these underlying problems. But a lot of times you can't find it on the physical. Either they're too young, so the findings haven't developed where you can find it on a physical exam, or they've never had symptoms before.
Okay.
Tragically, sometimes their first symptom is the first time they collapse and die on the field.
Wow. And you may have questions on this issue. If you do, you can call us right now, 741-9272, and maybe ask some questions of Dr. Ortega. But the equipment that you guys now use, is that also advanced to the point where we can detect these better?
Yeah, so it has improved. So in the past, our normal exam is just a physical exam, a history where you ask the kid questions and see if you can pick up something that would suggest that they're at risk of something happening. Some people over the years have advocated adding an EKG to our physical process to try and find these abnormalities in these kids. Okay. There's been a lot of controversy in the sports medicine world about, do we recommend doing this on everybody? Should this be part of our screening physical? And the problem with the EKGs has been it's expensive, it takes more time to do the process, and the EKGs would find things, would read it's something as abnormal when really it's normal.
I see.
And then that leads to more testing and more expense.
We saw a shot of a handheld device. Is that something that's new right there?
Yeah, so that's CardioScreen. That's a new device. It's handheld portable EKG. It's been specifically designed to evaluate athletes' hearts as part of our athletic physical process, and incorporated with this device is criteria that's been researched and developed to determine what's normal and abnormal for an athlete specifically, so that we can do a better job of screening athletes. And
normally, what is the heart condition? Is it AFib? Is it an enlarged heart? What is normally the issue there?
With young kids, like you're talking about people that are younger than 30 years old, it's a variety of things. The most common thing in the United States is an abnormally enlarged heart. Okay. So athletes develop an enlarged heart normally, but there's some abnormal enlarged heart conditions that lead to cardiac arrest and things such as that.
And talk a little about the Lord Wedgwood charity, what that is about, to also deal with the situation where maybe an athlete is on the field and has cardiac arrest.
Right, so the Lord Wedgwood charity originally began here in Birmingham to obtain AED devices and put them out in the public community to treat somebody.
You're talking about defibrillators.
Defibrillators, the AEDs, yeah, the public can use. Somebody had a cardiac arrest in a public setting. Now, recently, they've also begun incorporating the CardioScreen device into their charity, and they're going to be the driving force behind raising the funds to obtain these devices so that we can use them
it's good
on
work,
physicals.
Good work. We understand Rhonda's on the line with a question. Hey, Rhonda, how you doing this morning?
I'm fine. How are you?
Fine. What's your question?
My son, he wants to play football this year, but he was complaining about he was having chest pains. And is that something that we really need to look at before we let him go out there?
Yes, definitely. I would have him see his pediatrician or your family doctor, and let them start the process of a physical exam, and taking a history and see if there's anything there, and if he needs more testing to determine whether he's safe or not to play football.
But you mentioned some of this new technology. Does she need to seek a facility with that if her primary pediatrician doesn't have that type of equipment?
Yeah, I would start with the pediatrician or family care, and if they think they need something more advanced, then they can seek this as well.
This is Paul. I think he'll need something more advanced. Plus, like, he always said it hurts sometimes, then it's like he shake it off, so he ain't gonna really tell the truth. Somebody gonna have to really find it.
Right, but you need to start with your pediatrician or family doctor and let them begin the process, and then we can aid in that if we need to after that.
Yeah, definitely err on the side of caution there, I would think.
Yes.
All right, hey, thank you so much for the call. All right, we'll wait for another call if it possibly comes in. Again, 741-9272 for any questions of Dr. Ortega. I think we only have about 30 seconds left. If we get a call, Suzanne, just let me know real quickly. But now, the defibrillators, if 9 times out of 10, is there a percentage on how many times, maybe lives they would save in a situation of an enlarged heart?
Yeah, so oftentimes the AEDs or defibrillators will work if somebody has had an arrest. More commonly going to probably work in a younger, healthier patient. An older patient, an older adult, maybe less likely, but
okay,
they're definitely beneficial.
Well, I'm glad the work is being done in this field, because you've heard these horror stories, and it's scary for a parent. You got your kid out there playing football, he could have a condition he doesn't even know it.
It is.
All right,
Yes.
Doctor, thank you so
All right,
much.
thank
Really
you.
appreciate your time.